Hi, I'm Erin, and now we're going to do open and closed irrigation with gentamicin and normal saline. And before I go into the patient's room, I'm going to check the MAR. I'm going to see if they have any allergies, and I'm going to see why they're getting this. I'm going to just check everything, make sure you have the right patient. Now I'm going to go into the patient's room. I'm going to give them some privacy. I'm going to do 2 patient identifiers with their name and date of birth, check their bracelet. I would ask them for allergies again as well, just to see if they know if they have any allergies. I would explain the procedure to them and explain them why I'm giving them this procedure. And then I would, again, close the curtain, and I would let them know any side effects of gentamicin, which is like any troubles walking, maybe have some slight hearing loss, and then the typical nausea and vomiting. And so I would lift up their drape. I'm going to apply clean gloves.
No.
And before I start the procedure, I want to check their bladder for any distension, and then I also want to check their tubing, make sure there's no clots or sediment, and make sure everything's flowing nicely. And once you open this, everything inside of here is sterile, so you want to make sure that you don't touch anything inside. So you're going to lift it up like this, and then take it out. And there's an alcohol pad. And then only touch the ends.
It's so much more fun if you point out.
So there's a nice place so you can put the catheter. And then you want to put this here. Okay. So you want to grab your normal saline with your hand over the label. And the order calls for about 60 milliliters of normal saline, so you want to put as much in there as you can, still covering the label. Put it back in there. Okay, so now we are going to clean the port, or the this part of the catheter, because we're going to take it off. And you want to make sure that you don't touch the end of the catheter, because that part is sterile. So you're going to clean it off, let it connect.
And then I just have to get a urine sample.
You're going to triple up.
Just so you're aware of it, you do have a little water dribble on your shirt. I just want you to not like. I just want you to know about it prior.
Okay.
And it's little issues coming off.
I just checked the order for the Foley catheter, and I was assessing patient
There you go.
and weight.
It's a little tough. You want to make sure you put that in there. And you want to stick this in here until you're done. That wouldn't happen either.
I've talked to her about the procedure, and she is, a little bit.
Now you want to draw up about hopefully that stays. Draw up about 60 mils.
And then make sure you give it to
get all the air. Okay, well, I'm gonna redraw that up. I got a little too much.
I'm gonna go ahead and do, preliminary cleaning of the area and
Stick it in.
flow tape the area. So, I cleaned her
Probably
up.
they might feel slight pressure.
An absorbent pad.
I'm just gonna say, in this video, I'm gonna show you how to get in there.
It's just to protect the sheet, we'll have a sterile field on top of it. Yeah, and then make sure you do like clean gloves.
Let it drain out. And the goal of this procedure is to have the same amount that you put in and the same amount come out, about close to the same amount, unless they have some urine in their bladder. So you let that drain out for a little bit.
I'm going to assess the area, assess for signs and symptoms of urinary tract infection. And also with this, I'm going to tell the patient I might be feeling some pressure or buildup.
And again, you would check for any clots or sediment in their tubing, check for any bladder distension. You want to go back and record their intake and output as well throughout the day. And now we're going to do a closed with gentamicin. So since we don't need this anymore,
For about 20 seconds. Allow it to dry.
This absorbent pad.
hit the label again, and the order calls for about 10 milliliters, so you want to put as much in here.
The specified amount of urine for a culture is often 5 milliliters, but it's just on the location of what they don't.
Place it shiny side down.
This is urine is ready. Make sure to unclamp this. This is a sterile urine cup.
And when you do this, you want to make sure that you do clamp this. And the order says you need to clamp it for about 2 hours.
Sterile.
Clean gloves.
Put this back on, and I need to get this for around 20 minutes, and I'm going to label this
And I'm gonna put it on my cereal.
Pull up about 10 milliliters.
And get it to the lab. Was that everything for that? Then I just need to explain midstream. Should just go explain it to.
Now I actually probably clamp it, not like when I'm getting the medication ready, I'd clamp it before I do the procedure, like right before. And then you want to take another alcohol swab,
Explain how to do midstream urine
clean the
catch
port.
for a female, because it's harder, but also explain for a male. So you're gonna have them come in and tell them what they're going to be doing. For a female, you really have to stress the cleaning. So they're gonna go in there, they're gonna have a sterile cup, they're gonna bring it in and have a wipe and pad. I'm gonna tell them when they open it, they need to leave the cap up, you have to touch it, what's inside of it. And
And again, let them know any side effects of gentamicin, which I explained earlier was like any trouble walking, hearing loss, typical nausea, vomiting, and to let the nurse know if she does experience any of these side
if
effects.
this, again, don't touch the inside. You have to stress that they have to start peeing and then place the cup under midstream, because you're letting the first urine that has all the bacteria, and you want clean culture. So make sure that they know to pee for a couple seconds, place the cup under
Place
the
the rest
cup,
of my drapes.
and close it. And then wash their
So
hands and
it's
probably
my
have them
sterile
repeat that
field.
back to you so you know that
The
they
finished drainage drain.
And for a male, it's the exact same. They just clean.
I keep it clamped for about 2 hours and to let them know if they feel any pressure, maybe we can come unclamp it. But you want to record, make sure they have, like when you come unclamp it, there's no clots, anything, any sediment in the tubing. Check bladder distension again as well, and then record if they have any side effects from the gentamicin, or ask them if they do have any side effects from the gentamicin. And yeah.
I have to